My main objective as the assessments of the prevalence of hypertension in the selected rural areas, and secondary objectives I just want to say the awareness about the hypertension, knowing about the patient's care, knowing about the demographic influences, what kind of the people are being engaging with this kind of the hypertension related activity. Assalamualaikum everyone. This is Dr. Hossain Al-Amin. I'm working as a international practitioner of public health, and I'm a public health specialist. Today I would like to present very common presentations, but it's very common as ourselves. You all know about the hypertension. It is the main and major risk factors around the world, and it can impact and affect everything else that we have discussed earlier. I'd like to focus the prevalence of hypertension in the northern areas of the Bangladesh. The presentation is a very short and summarized presentation. In my discussion, I will focusing on the backgrounds, why I am taking these key goals and global and national context in my background. Then I will focusing on the rationale, why we are choosing the rural people for this kind of the research. Starting is what is my primary and the secondary objectives to done these things. Then what methods I have planned to do these studies. Then the results according to the demography prevalence regarding the hypertension. Then there's a very few discussions, conclusions, and the recommendations. Hypertension, around 1.28 billion people has suffering from the hypertension according to the World Health Organizations, and the age number is 30 to 69 of our age, and it's very much full of ourselves that 46% of the people don't know even about the hypertension, and among them 42% are treated. That is, they know about the hypertension, they go to the diagnosis and treatment has been done, and the very few are the controls. Only 21% are the control. That means they are taking the medication, go to the doctors, going to the hospitals regularly. Complicated anytime. Hypertension can turn into the heart attack, turn into the stroke, and a lot of the complications may be the develop. So hypertension is a premature causes of the death. We all know about the hypertension is a major risk factor, so it can be the culprit of the any other diseases. So what's happened in Bangladesh? So according to the data of the National Survey 2022, 4.1% prevalence in the men and 23% in the women, prevalence less. And the magical thing is we are always thinking like that the hypertension is a disease of the urban peoples, but honestly speaking, when we go to the rural context, we see the lot of the peoples are in the hypertensive patients, and the main risk factor is a salt intake. So why I am choosing these things? Basically, the rural people are mostly focusing on the communicable diseases. They are not worrying about the non-communicable diseases. So I think the research should be like that, not being like only urban people. So I wanted to showing about what is their health infrastructures, what their awareness, are they knowing about the hypertension, are they taking the antihypertensive drugs, if the diagnosis. So that is my rationale in my things. So my main objective as the assessments of the prevalence of hypertension in the selected rural areas, and secondary objectives I just want to say the awareness about the hypertension, knowing about the patient's care, knowing about the demographic influences, what kind of the people are being engaging with this kind of the hypertension related activities. The methods, I have done the cross-sectional studies, and my study area is Rohimapur, Taraganj, Rangpur. It's a remote area in Bangladesh in the Rangpur divisions, and I take 120 participants, and it's a randomized selections and doing the face-to-face interview, and for the analysis I using the SPSS 22 version. So what are the results? If I focus on the demographic results, there is male is a 47.5% and female is the rest one, and there is a majority of the patient is a 28.5% is in the 31 to 40 years, and this is because there is a very high risk group, and I see there is a educational level 39.38% are uneducated and 45.23% are the housewife, and 29.3% are the hypertensive that I got, and that is more than the national level. And it's very alarming that the rural people are right now going to the hypertension, and unfortunately they are not worrying about the hypertension so much, and they are not going to the doctors as well. And I see there is a 53% know about the hypertension, but they are not taking the preventive measures, and ultimately they are going for the irregular antihypertensive drug. And you all know irregular antihypertensive drug may turn into the strokes anytime. So that is very alarming. So the discussion point is very six. It's a slightly exceeds gender disparity and the similar prevalence around the world. And the conclusion is very six. There is a high prevalence rate. We need to focus. People should have to be knowing the more knowledges. There is a lack of the knowledges. there is a lack of the awareness, so we need to go from the public health intervention. Recommendations, we need to go for the community level engagement, we need to go for the public health encouragement, and the research recommendation, we need to focus on the longitudinal study to get this science in the longer way, because only the cross-sectional studies and 120 participants cannot get the best results. For we need to go for the longitudinal studies, and ultimately not only the research article and presentation is sufficient, we need to convert it to the policy so that we can turn all the rural people to our take cares, and awareness and public health perspective is highly recommended for my recommendation. So we have already done into the Journal of Medical Discoveries. My supervisors already in my chair, Dr. Mona sir is here. So that is already published into the international journals. Here is a link. So if you have interested, you can go for the links as well. And this is a reference, and this is all about from Dr. Al-Amin. Thank you so much, everyone. If you have any questions, so you have provided to me.